Menopause is not a disease, it is not a failure of the female body, and it is not something women should just endure in silence. Yet, for millions of women, menopause arrives with confusion, fear, brain fog, intimacy changes, weight gain, and emotional shifts, often without proper medical explanation. Today, we are going to break menopause down clinically and clearly. You'll understand what menopause really is, when it actually begins, why your brain, mood, libido, and body feel different, which symptoms are normal, and what changes you must accept, monitor, and medically address. This is menopause from a medical lens. What is menopause? Clinically speaking, menopause is defined as 12 consecutive months without a menstrual period, without pregnancy, illness, or medical intervention, due to declining ovarian hormone production. The key hormones involved are estrogen, progesterone, testosterone. Yes, women need this too. Menopause is not a sudden switch. It is a biological transition driven by ovarian aging and hormonal instability. What age does menopause really begin? This is where many women are misinformed. 1. Perimenopause, the real beginning. Perimenopause usually begins between ages 35 and 45, sometimes earlier. During this phase, hormones fluctuate wildly. Periods may still be regular or slightly irregular. Symptoms begin before periods stop. Many women are told, "You're too young for menopause." Medically, this is incorrect. Perimenopause can last 7 to 10 years. 2. Menopause, the marker. Average age of menopause, 51 years globally. But some women reach menopause at 45, others at 55. Genetics, smoking, autoimmune conditions, and surgeries all influence timing. 3. Postmenopause. This is the phase after menopause, when symptoms may improve or evolve into new ones like bone loss and cardiovascular risk. What's actually happening inside the body? During menopause, estrogen production drops, progesterone becomes erratic. The brain struggles to regulate temperature, mood, sleep, and memory. The ovaries stop releasing eggs. Inflammation increases, muscle mass decreases, fat redistributes. This is a whole-body hormonal recalibration, not just a reproductive event. Brain fog and cognitive changes. Brain fog is real. Clinically, estrogen plays a role in neurotransmitter signaling blood flow to the brain, memory formation, attention, and verbal recall. When estrogen fluctuates or drops, women report forgetfulness, difficulty focusing, slower word recall, mental fatigue. This is not dementia, this is hormone-related cognitive disruption. For most women, cognition stabilizes post-menopause. Sleep disturbances and fatigue. Menopause disrupts sleep through hot flashes, night sweats, cortisol. Imbalance, reduced melatonin production, poor sleep then worsens, anxiety, weight gain, blood sugar control, mood swings. This creates a vicious physiological cycle, libido and sexual changes. This is one of the least discussed but most impactful changes. Clinically, declining estrogen and testosterone cause reduced sexual desire, vaginal dryness, thinning of vaginal tissues, genitourinary syndrome of menopause, pain during intercourse. Reduced arousal response, important to understand. Loss of libido is not psychological weakness. It is neurohormonal. Desire may change, but intimacy does not have to disappear. Hot flashes and temperature. Dysregulation. Hot flashes are caused by estrogen's effect on the hypothalamus, the brain's thermostat. Even tiny temperature changes trigger sudden heat, sweating, palpitations, chills afterward. This is a neurological response, not anxiety. Mood changes, anxiety and depression. Estrogen directly affects serotonin, dopamine, GABA. As levels fluctuate, anxiety may increase, mood swings intensify, panic attacks may appear, depression risk rises. This does not mean menopause causes mental illness. It lowers emotional resilience temporarily. Medical support matters here. Weight gain and body composition. Menopausal weight gain is not about laziness. Hormonal changes lead to slower metabolism, insulin resistance, loss of muscle mass, increased abdominal fat. The body shifts toward fat preservation as a survival mechanism. Long-term health changes. Postmenopause increases risk of osteoporosis, cardiovascular disease, metabolic syndrome. This is why menopause is considered a critical medical transition, not just a life phase. What should you accept and what should you not? Accept temporary brain fog, changes in libido, fluctuating emotions, energy shifts. Do not normalize. Severe depression, debilitating anxiety, painful sex, extreme fatigue, rapid bone loss. These require medical evaluation. Menopause is not the end of vitality, femininity, or strength. It is a biological recalibration, and when understood, it can be navigated with dignity and medical clarity. If this video helped you understand your body better, subscribe to Wellness Corner, share this with a woman who needs answers, and remember, your symptoms are real and your health matters.